my breast implants are malpositioned and I want to go smaller. Can I get them replaced without a lift? Yes, for sure you can, Jude. Absolutely fine. The only problem is, and I guess it depends a little bit on how long you've had them in, because the fact that you are asking about the lifting is that the implants will have stretched the skin a bit. If you haven't had them in for long, it might not matter too much, but if you have had them in for any period of time, that skin will be stretched. And so can you have them replaced without a lift? Yes, but there may be a shape compromise. Their shape might they might sit a bit low, they might droop a little bit. Okay, you've had them in for 4 years. So yeah, 4 years is a fair period of time. So that skin will have stretched in that time, and so the shape might not be as good, basically. So yes, you won't need a lift, but you might not have very good shape. It's difficult with, without seeing you and examining you and seeing, because some people kind of need a lift already. So if you kind of need a lift already or borderline for a lift now, I'm not saying you are, because I don't know anything about your situation, but if you are, and then you downsize your implants, you're going to need a lift even more. So the shape will be worse. So it's just having a conversation with your surgeon and doing what's right for you. And if you don't want a lift, fine, don't have one, but accept the shape might not be quite so good and they might be a bit droopy. And sometimes when you've got implants in, you can have kind of like an implant here in the breast drooping off the implant, kind of falling off the implant, which doesn't look great. And if you are, I mean, as I say, it depends on, it's hard to do this because I don't know anything about you, but if you are one of these people who's are worried about this, then on paper, if you don't want to lift, the way to get around that is to use a bigger implant to kind of take up the skin, take up the slack, if you like. But if you don't want a bigger implant, then obviously that'll make your breast bigger. So you might say, I don't want my breast to be bigger, I want them smaller. Okay, well, you can get the size right by having them smaller, but there might be a compromise on the shape. The shape might not be as good. So it's about going into surgery with expectation on what you could expect. So you don't go in and come out thinking, hold on a minute, they look worse. Because they might look worse, quite frankly, if they are smaller, because they might be a bit more droopy. Now, you might be happy with that because you don't want the size, you're happy having the smaller size, but yeah, expectation, that's the job we have as surgeons, to try and get our expectation on the same page so you know what to expect, so you're not unhappy if the outcome is what we thought the outcome was going to be anyway, sort of thing. So good luck, Jude. I don't want to be negative, but just realistic. That's what it is. Be positive once you made the decision for surgery, but be realistic. Yes, if you're going smaller, they might be a bit more droopy than they are.